Afternoon, good evening to you all around the globe. My name is Iman Ali, and I am so excited to kick us off for our event today. Before we get started, I would like to make a quick logistical note. We are offering today's event in both English and French. So can all, including our English speakers, click the global icon on the bottom of your Zoom ribbon and choose your preferred interpretation. You can also click the mute original audio in order to make sure that you don't hear the speaker's language in the background of your translation. So if that's all set, we are smooth sailing. And because we have a jam-packed schedule lined up for you all for the next hour and 15 minutes, I am really honored to get us started. Again, my name is Iman Ali. I am one of Pathfinder's Acacia Circle members, as well as a liaison for our global partnership with Women in Global Health. We're really excited to have this global partnership be celebrated today and to shine light on our amazing 6 panelists, our leaders from both organizations, to showcase the importance of youth advocacy, on health service access, on making sure that our youth leaders, our next generation, Gen Zers and millennials, speak up and speak out on matters that matter to them. Today, we'll be focusing on the Global Her Act, and this event is a lead up to the Generation Equality Forum that is being held from June 30th to July 2nd, and it marks the 26th anniversary of the Beijing Conference on Women's Rights. So we are very lucky and honored to have keynote remarks being said by Representative Chrissy Houlihan before our amazing panels. So Representative Chrissy Houlihan is a US Air Force veteran. She's an educator, an entrepreneur, an engineer. And speaking of gender equality, she's the first woman ever to represent the great state of Pennsylvania's 6th congressional district. We're really honored, and it's my distinct honor to introduce Representative Chrissy Houlihan. And you have the webinar floor now.
Thank you. And thank you very much from Washington Statuary Hall. And if you stood in this room that I'm in right now and counted, you would count only, I think, 2 statues around me that are of women. And that's pretty similar in every building that I go into here in Washington. But I'm grateful very much for the opportunity here from Statuary Hall to have this historically important conversation. And thank you to the Women in Global Health, Pathfinder International, and all of you for being here today. As you mentioned, my name is Chrissy Houlihan, and I represent the people of Pennsylvania's 6th District in Congress. To give you some perspective of where that is, it's just outside of Philadelphia, the city of brotherly love and the cradle of liberty for our country. And I'm really grateful to be in this virtual space today alongside a group of people who are so invested in safety and health and empowerment of women and girls across the globe, as invested as I know I am in this. Too often in today's political climate, women's global health is seen as nothing more than that, a phrase that suggests that this is a conversation solely about women's issues. But for me and for many of you I know, such a label is not only limiting, but it betrays a grave misunderstanding of foreign assistance. Before coming to Congress, I served in the United States Air Force, as you mentioned, as an engineer. I was focused on anti-ballistic missile defense at the very tail end of the Cold War era. And my background in service is steeped in national security. And so when I approach this issue of women and girls, it is through that lens. And what we in this room, this virtual room, all know to be true is that the elevation and projection of women and girls has to be a priority for the United States. In pursuit of equity across gender lines, we are long overdue. But what baffles me about some of my colleagues right here in the halls of Congress, particularly those on the other side of the aisle, is the inability to connect those dots between protecting women and girls and the national and international security. Study after study after study has shown that where women have access to health services and where they live in a society that empowers them, peace, security, and stability will follow. The International Peace Institute found that when women participate in peace processes, the resulting agreement is 35% more likely to last at least 15 years. And as an engineer, you know, I can appreciate data. The Belfer Center at Harvard also observed that higher levels of gender equality are associated with a lower propensity for conflict, both between and within states. If one is really serious about elevating women and girls, then one has to be serious about creating avenues for accessible reproductive health care. The global gag rule is not just about prohibiting providers from educating their patients and offering safe and legal abortions. It's also about keeping women in the dark and disempowering them by denying them bodily autonomy. The global gag rule is a painful reminder of how far we need to go still to advance genuine equity for women and girls. And it's not only a deeply flawed policy that fails to achieve its intended outcomes, but it's also, as we've talked about, a security risk. In denying women what is often life-saving care, we are creating and exacerbating societal instability. After all, we cannot empower women who do not survive childbirth. Globally, pregnancy and childbirth complications are the leading cause of death amongst girls 15 to 19 years of age. A Kenyan study into maternal deaths revealed that 1 in 10 who died in the hospital were teenage girls. Of pregnant teenagers who survive childbirth, 98% drop out of school. As a government, we have no right to insert ourselves into an individual woman's decision of whether or not to have a child. And by denying women that choice, we are contributing to a more volatile, more violent world, while risking global instability and our own national security as the United States of America. Repealing the global gag rule is both the right thing to do for women and the smart thing to do as a world's leading foreign assistance provider that is concerned with our own national security. By contributing to a more open and equitable society, we are also helping to build a more peaceful and stable planet. And I know that I speak for all of us when I say the politicization of women's health, both domestically and abroad, is really unacceptable. People are playing politics with young women's lives and by extension contributing to a toxic discourse that has real serious global ramifications, all of which that chip away at the progress or the lack thereof that we as women have made both here in the United States and abroad. Any and every elected leader in the United States who claims to support women or to care about national security should stand firm in their commitment to repealing the global gag rule. And that's why I'm proud to support the Global Health Empowerment Rights Act, or the HER Act. This historic bicameral legislation would do exactly that. It would permanently repeal the global gag rule. Passing this legislation is a crucial and critical part of the larger puzzle that is the active pursuit of equity for women and girls. The previous administration here in the United States willfully abdicated its responsibility on this front under the guise of protecting life. But what is clear is that this policy puts more lives at risk, the lives of women and girls everywhere who rely on unbiased and science-based care for their survival. Thankfully, President Biden has made it clear that he not only understands this fact, but he also understands the intersection between women's empowerment and national security. He's willing to literally, as we speak, roll up his sleeves and put in the necessary work to make up for those last 4 years. And I'm very proud to stand alongside of him in that effort. In a parallel effort as well, yesterday I reintroduced my support for the Unfpa Funding Act. This legislation, which has earned the support of more than 100 of my Democratic colleagues, would formally authorize the United States for the United States Population Funding Fund, UNFPA, and lead UN organization that works to deliver a world where every pregnancy is wanted, where every childbirth is safe, and every young person's potential is fulfilled. Like the Global HER Act, my support for UNFPA Funding Act is as much about elevating women and girls as it is about increasing global stability. Humanitarian aid and security are two sides of the same coin, a fact that we as a global leader in the United States need to really readily acknowledge. Where we go from here is so important. In the United States, we have an administration that is aware of just how vital the protection of women and girls is, and just how obvious the intersection between security and the gender equality gap is. So I'm grateful to be in such a virtual, crowded room today, because I'm reminded of the many people who are committed to gender equity around the world and who are involved at every level of advocacy in government in order to make meaningful change. Now, more than ever, we need our collective efforts in this area. In the United States, we have a majority in this Congress and a White House that are committed to this cause. It's only now that we have the opportunity to continue to advocate for progress. Thank you so much for your time today, and thank you very much for welcoming me to this conversation and for working alongside me and my colleagues to build a more better world for every woman and every girl. And with that, I'll turn it back over to you.
Thank you so much, Representative Houlihan, for those powerful remarks. I was definitely taking notes down because there's so many great work that's going on behind closed doors, and we appreciate your efforts and letting us know the importance of what we're doing here today. So I would like to start off with quick introductions. We have a number of amazing panelists from both of our organizations giving comments today. I would also like to first have Mwende Muya introduce herself as my fellow co-host, and then we'll do lightning round introductions with the rest of the panelists. Mwende?
Thank you, Iman. So my name is Mwende Muya, and I work as the Chapter Development Manager at Women in Global Health, and I'm happy to be here with you all for this important discussion.
Great. Thank you, Mwende. I'm going to go in no particular order and just say our panelists, and if they can quickly give a brief introduction about themselves. First one I'll have is Cecile Yugbare.
Merci beaucoup, Iman Ali. Je ne peux pas activer ma vidéo, donc j'y vais comme
my
ça.
camera and turn on my video, but my name is Cecile Yugbare. I'm a journalist and a political analyst for health, and I work as a coordinator rather, for advocacy and communication for Médecins du Monde in France. And I am I'm a lawyer by training, and I work in Burkina Faso. Thank you.
Thank you so much, Cecile. If we can have all of our panelists turn their cameras on as we get started for the panels, that would be wonderful. Next off, I'll have Peju Adeniran introduce herself quickly.
Hello, everyone. My name is Dr. Peju Adeniran. I'm a physician. I live and work in Nigeria. I work in public health, and one of the areas of my specialization over the years has been sexual and reproductive rights for minorities. I'm very invested in programming for those. Thank you.
Thank you, Peju. Next, can we have Lenice Williams introduce herself?
Yes, hi, good morning, everyone. My name is Lenice Williams. I serve as the Vice Chair for the Women in Global Health DC chapter, and I work full-time with Encompass LLC as a Gender Integration Specialist, where I do work around gender-based violence prevention and response and ensuring that gender is integrated throughout various programming, particularly in the health and development sector.
Wonderful. Thanks, Lenice. Can we have Andy Tucker introduce herself?
Hi there. My name is Andy Tucker. I'm the communications lead for Women in Global Health Georgia, and I work for the Task Force for Global Health in Leprosy Elimination.
Great. Thanks, Andy. And then can we have Kashmira Date introduce herself?
Sure. So I'm also from the Women in Global Health Georgia chapter based in Atlanta, Georgia. From the land where Stacey Abrams comes from, an incredible woman leader, and then our incredible youth senator here from Georgia as well. I am the mentor match lead for the WGA Georgia chapter. I'm a physician by training with a background in public health and working on vaccines.
Great. Thanks, Kashmira. And lastly, can we have Asanatu Bamogo introduce herself?
Hello, everyone. I'm Asa. I'm an adjoint to the manager of Program and Partner Area for Women in Global Health Francophone West Africa. And I'm also the coordinator of Women in Global Health Niger chapter. I work full-time as the coordinator of the CDC HICE project in Burkina Faso, mainly focusing on the vaccine preventive disease on the surveillance system with the Ministry of Health. Thanks.
Thanks, Asanatu. So lastly, I'm going to be introducing our two wonderful moderators. They are both Acacia Circle members with me. First off, can I have Vanessa DeVayo introduce herself?
Hello, good afternoon, everyone. My name is Vanessa DeVayo. I'm a global public health professional. I'm currently at work for Impact Hub Lagos, and I'm based in Lagos, Nigeria. And I'm also a mental health advocate that runs a nonprofit focused on mental health on the African continent and the diaspora. It's a pleasure to be here, and I'm looking forward to the conversation today.
Thanks, Vanessa. And Michael Ann Morrison, who will be starting our first panel. Can you introduce yourself?
Good morning, everyone. I'm sorry that for some reason I'm having some trouble with my video, but I'm really pleased to be here with all of you. My name is Michael Ann. I am from Austin, Texas. Oh, looks like I might be able to start this. Here we go. Hi, my name is Michael Ann. I am in Austin, welcoming you all, and I am really proud and honored to be a founding member of the Acacia Circle through Pathfinder International.
Great, thanks, Micah Ann. And you have the webinar floor to get us started on our first amazing panel on the reproductive health services that we're going to be talking about.
I'm really excited to dive in, and I'm honored to be among women who are doing just absolutely incredible work on behalf of their communities around the world. And we have a very global panel with us today, which is very exciting. I'd like to start off by hearing from anybody who's comfortable answering a quick testimony of what it's like gaining access to healthcare services in your community, whether it's easy or difficult, is it close by to where you live, inexpensive or expensive, welcoming, that kind of thing. I'd love to hear some testimonials.
Okay, I will go first, but I'm going to first preface with the caveat that I'm a physician. So my personal experience does not mirror the experience of other women. It is not only important that I'm a physician, it's also important that on a social scale, I belong to a somewhat middle to upper class. So again, my experience does not mirror the experience of most of the women who live and work in Nigeria. Hence the reason why this is my life's work. Health access in Nigeria disproportionately categorize women as a minority from an access point of view. This is because women are less likely to be educated as the men, less likely to be financially independent, and less likely to be socially independent. This means that being able to reach the centers, being able to ask questions, being able to not have a fear for a system that they don't necessarily understand because of a poor education. Most of our centers deliver services in, I would say, first of all, the language is English. I live and work in an urban area, and even so, there are challenges with women, and when I say a woman, I want us to think about the average woman from a lower socioeconomic class that lives in my country. So it can be daunting for her to be able to approach the system and feel that she can be seen and be listened to. So that is one of the challenges that women will face, even when the health services are available. That has been the experience. The experience of privileged women is very different from the experience of women who necessarily do not enjoy privileges because of historical background, poor education, and not necessarily the same advantages or access as men.
Thank you for that insight, Peju. I think a lot of people on this call might have had a similar experience of not being seen or feeling listened to by the healthcare professionals that are available to them. So I feel that deeply, that hopefully that's something that we can help improve. Who else would like to share a story about their experience gaining access to healthcare services?
Maybe I can go ahead with some of my experiences. I think as Peju said, I kind of feel that I'm in one of the privileged sort of places where access personally for myself is not an issue. But now when in the place where I work, right, like global health, I mean, we really need to think about global health as interconnected. I work in some of the most resource limited settings across the world. They are called resource limited settings for a reason. Time and again, we've seen that when women are involved in health, women just not lift up the health for themselves, but for the entire communities. So, you know, I mean, I think that in my experience, what we've seen is especially in these settings, integration of services becomes really, really important. You know, I've been working on global immunizations and vaccines for children and some of the most vulnerable populations across the globe who really, really have very, very poor access to some of the basic services. Often people walk for hours before they can get to a health service center to get even some of these basic immunization related services, vaccinations. And especially when they have multiple children, when they have to get to these services, they often have to pick and choose in terms of, you know, when they can get those services, how often, how, you know, how they can try to combine some of these services together, get some care for themselves, which is often very low on their priority list. So, you know, integration of services and being able to leverage different healthcare contact points becomes extremely important. We've seen many successes when we've seen combination of these maternal reproductive child health services, provision of water sanitation hygiene services with basic care packages, things like that. So I think that especially in these hard to reach places where there's often just like maybe one NGO or one healthcare service provider that's providing a myriad of services, if you have all these restrictions in place in terms of what they can and cannot do, it really affects entire communities. So I think it's imperative that we look at global health as interconnected and have that sort of more holistic approach for health for all. You know, I think that's really critical.
And Kashmira, I have a follow-up question for you related to that interconnectedness that you just spoke to. Have you seen real-life instances of how changes in the policies of the United States has directly impacted your ability to access the services that you need?
Yeah, I mean, you know, I think in a couple of settings, you know, we did see that with these kind of restrictions in place, often there is quite a bit of confusion in terms of, you know, what people can, you know, what kind of services can be provided, what cannot be provided. You know, there is a lot. And I think when people start erring on the side of caution and, you know, really scale back, we've seen that a lot of times, you know, it's not just the individual who's impacted, but also, you know, their families are impacted, the communities are impacted. There is, you know, word of mouth when, you know, people talk about a healthcare service being provided earlier, now not being provided, how people perceive overall healthcare, you know, and that their confidence in healthcare provision is affected as well. So especially when they don't have very many options, I think it really impacts the health of the entire communities. And we know that, you know, even children die from some of these most preventable disease causes. And so when you're able to combine these, when, you know, it does help with service provision for the entire community.
And I believe you work with an NGO that's providing health packages to women. Is that the case?
No, I actually am in the private sector in terms of my work, but, you know, my work is oriented more towards these resource limited settings. So we are working with different partners to how, you know, in terms of how we can make sure that these services become, you know, more available and accessible to people who need them the most.
That's wonderful. Thank you so much. And I'd love to open up this question to other panelists as well. Especially for those of you who live outside of the United States, but it's open to everybody, about real life instances that you've seen US policy changes impact your work or women's ability to access healthcare services.
Yes, I can jump in on that. And to, yes, add to what Kashmira said. As the coordinator of the vaccine preventable disease going to rural area, and I have witnessed women refusing to even confide to the medical officer that they they are good now to go home because they don't want to go home because they don't have what to care for the child. Women that have deliberately let the child sickness because they have too many to care for, because they cannot afford to care for them or pay service for them. I have witnessed all of this, and I co-founded a local NGO which is focused on reproductive health, especially cervical cancer screening and family planning delivery in rural area. And during those restrictions, we didn't have much of our activity are shut down because it was hard for us to implement and reach out to community without with those restrictions. And many other reduction has been witnessed in the implementation within the public health sector, access to comprehensive sexual, reproductive, and health, community outreach activity, which are the main way of how people in rural area access to healthcare service, at least in the community where I am. And also HIV and AIDS prevention efforts. We have seen them that weakness and sexual transmitted infectious screening and treatment reduced, and which put a lot of risk out in the community. Many of them, and especially the weakness the healthcare system, the progress we made into the existing system, as well as what we're looking forward to. I think that NGO and those work have really a big contribution in our community, especially for rural area. And we need them to preserve the progress we have already made. And we all know that with COVID-19, which has reminded us how significant it is to promote health equity for the safety of our world. So yeah, I really want to advocate for that, and in order for us to preserve what we already gained and move forward toward universal healthcare. Thank you.
Thank you so much for that insight, Asa. Are there other panelists who would like to speak to US policy changes overseas?
I'm sorry, I got logged out for a minute. So
Welcome back. Would you like for me to repeat the question, Peju?
Yes, please.
Sure. So especially for panelists who live overseas, we were discussing real life instances where you have seen how changes in US policy directly impact a woman's ability to access healthcare services.
Okay, yes, I'm happy to take that question. First of all, working in this space for a while as a physician, and then working in sexual minorities, of which women are a part of, we kind of understand, we've come to expect the ping pong that tends to happen with the global gag. And we know it's how much the issue is very politicized, and how politics in the US can have far-reaching effects, so that you have women as programmers, as beneficiaries from lower to middle income countries having skin in the game of American politics directly from funding that goes to provision of healthcare services. In 2017, when we had another era of the global gag rule in the current state. First of all, there was a lot of confusion on what it meant, and oftentimes that tends to be one of the biggest problems. Nobody really knows what they can do or what they can't do, and nobody wants to have their funding cut off. So everybody errs, like one of my panelists said, nobody wants to err. So people are extremely cautious, which is very disadvantageous from a programming point of view. In the CSO space and the NGO space, there's often a lot of collaboration between organizations who are offering advocacy, healthcare services, WASH, because we're all in the same space together. But there is what we call the chilling effect that happens when there's a globe, because you don't know where your funds are going to get threatened because you want to align with a certain organization who's offering abortion services. Again, Nigeria is a country that is very patriarchal in our politics, and it tends to mirror other places where the politics do not promote the female autonomy over our own body. So because of that, abortion, in the definition of abortion in Nigeria, which is a different conversation, abortion is illegal in Nigeria. What this means is that women have no choice but to have to access abortion from safe and unlicensed places. And that is what legalization or making illegal is forcing women to do. And so we have an increase in maternal mortality, we have an increase in morbidity from these abortions. And then also, because the policy affects abortion, but the global Gag Rule also expands to not just abortion, but contraceptive education. Many of our programs are also integrated. So you find that while within sexual health delivery service, you have women being provided for WASH services, education, literacy, all within an integrated program of sexual health. So if the sexual health program funding is threatened, I want people to see it's a multi-product in low resource places, because once you have a woman walking through the door for one service, what you try to do is to ensure that you plan for as many services that she can get, because you never know when you're going to see her again, if ever. Because there are several hurdles that she often had to cross to be able to come into the clinic that day. Personally, the environment since 2017, I can speak to 2019 in Lagos, where one of the most important places where women are referred to for abortion, rape services, post-exposure, marriage stops, in the environment of the global Gag Rule, and all which already met our patriarchal political situation, implementers, policemen were going into clinics that were offering sexual and reproductive rights to women and trying to shut them down. 2 offices were vandalized, and people went in there, broke the glasses, threatened to attack staff, saying that, oh, they're offering abortion services and abortion is illegal. At that time, women who would otherwise have come in were afraid of coming in. Staff were afraid of coming in. And what tends to happen is with the global gag is even when you repeal such temporarily, the effects are not inelastic. Every new HIV infection that happens throughout that time, the effects don't reverse back to status quo in progress or direction. The number of new cases of unwanted pregnancies or maternal mortalities, they will happen. They will still happen, and they don't go away because for now it's repealed. And that's why the HER Act is extremely important, because it protects once and for all. I think the health of women, the autonomy of women being able to control, make decisions over their body is almost sacred to me. And we should definitely must separate it from the politics. Because what happens in the US, I know there's this popular saying, the US sneezes and everyone catches a cold. And it's true, we saw that. We saw less women who are able to be referred to those centers for rape services, gender-based violence services, education, and WASH. So that did happen. And I saw that in the years past.
It was so beautifully put, Peju. Thank you for sharing your insight there. In the last few minutes that we have for this particular panel, I'd like to open up the question of what changes need to take place to ensure more equitable and compassionate care for women in your community. And that'll be the perfect segue into how advocacy can bring about those changes. Is there anyone who'd like to provide any insight around changes that they see that could be very helpful for their community?
I'm happy to take it. I was just hoping I didn't want to speak over anyone else, but I'm happy to let other people take that.
We'd love to hear your insight, Peju. Thank you.
Oh, okay. I kind of I kind of mentioned it before, but first of all, politics must be divorced from the autonomy of the woman, of women's autonomy and rights. Must be divorced once and for all. First of all, there are people that say, if you look at the biology, we are actually providing contraceptive for the wrong gender in the first place. There's only so much reproduction that one woman can do. Far more than one man can do, but let's leave that alone for today. We definitely need to separate politics from the autonomy of the woman. And I think once we get that right, and we understand that as a mind shift, then so that has to be, and of course, funding, being able to, and one of the ways is being able to protect the funding that goes into supporting services that are not just targeted to women, but women can benefit from. Like the data clearly supports that when women are empowered, the society gets better. We've known this. It's almost a no-brainer, but it's like this is data that I feel like there is almost an effort to hide. I have to remind myself of this every day. And so again, so I wonder who's scared of women who's scared of empowered women when the data says this is exactly what you must do in order to have the peace with which that you seek, right? So I think for me, long-lasting, separate politics from not just the woman's autonomy, but from the autonomy of our bodies, we separate politics from it. Second is galvanize and ride on the advocacy that is coming from the next generation, which I mean is a great segue to the next point. I don't want to jump in, and I think there's a broader conversation about that because I'm not going to be here in the next couple of years, but the world will continue to exist for people that come behind. So plugging in and ensuring that the train continues to move, plugging in and ensuring that the movement survives what we're saying today. And today can be this month, it can be next 6 months, plugging in and ensuring that the movement survives us who are here today. I think if we can do those two things so that we, if we can get those two things right, we're on the right track.
And maybe there's, yeah, I can just add to that. That was excellent, Peju. Just another, angle to pursue. I mean, of course, sort of like demand generation at that level, at the local level, like really making sure that the women feel empowered to do that. I mean, understanding that they have that level of support with each other. I mean, can we build some of these networks? I mean, there's already a lot of work happening in this space. And then I think the second piece is, I mean, in all of this, I think men really need to come on board. I think it's interesting how Peju put it, like, why is it threatening? I mean, how can they understand that, I mean, I think we really need some champions. So are there certain, influential figures who have, the community's ears and trusted by the communities? Can we bring them up to speed? Can we find those champions? Can we find those allies, male allies especially, who can help elevate the voices of the women and really, kind of highlight to the overall community how this is beneficial for everybody overall and not just for the women.
And to your point, that's an excellent point. We just had some new members join the Acacia Circle for Pathfinder, and several of them were men, which was really exciting to see, because I do think we need those allies to push this agenda forward. And with that, Iman, I'm going to pass it over to you for our next panel. Thank you so much for the insight that everybody provided.
Yeah, absolutely. Thank you, Michael Ann, and thank you to the panelists for those insightful remarks on health service accesses. So many good things to note. Peju, I haven't heard that statement before, that when the US sneezes, the rest of the world gets a cold or gets a flu. Like, that is a very powerful statement in itself. It may or may not be live tweeted at this moment on Twitter. So see if that's going to be on your Twitter feed later today. I would like to hand it over to Vanessa to talk about advocacy and youth involvement and how we can get our leaders to be involved with these matters that a lot, and especially the men that are on the webinar today. How can you get involved with this matter? And yeah, thank you again, Vanessa, you have the floor.
Thanks so much, Iman. All right, I'm really excited about this panel. I think the first panel, we learned so much about health service access, and I'm really excited to get into advocacy. So we all know that advocacy is an imperative to people's voices being able to be heard. And we know that through advocacy, especially from the younger generation, we can get a lot of people to become more aware and understand exactly what is currently going on within women's rights. So I want to just throw the first question out there. What does it look like to have young people be most effective when it comes to advocacy? And do you guys have any example that you'd like to share with the panel in regards to what's been happening in your own communities?
Vanessa, can you repeat the question again for me? I'm sorry.
No problem. So I said, what does effective advocacy look like for you? And if you have any example of particular effective advocacy that's happened, especially amongst the younger generation and within your communities.
Yes, I think when we think about effective advocacy, I think when we look at what's currently happening within the global health space, from ending the global Gag Rule once and for all, with a lot of the various other social justice movements, I think we are seeing effective advocacy. I think we are seeing young people really mobilizing, using grassroots efforts, connecting not only with their members of Congress here in the US Congress and Senate and House Representatives and Senate, but also reaching out to their local representatives as well. I think for effective advocacy definitely includes having a very clear message, making sure your message is clear, what it is that you want to receive, and making sure that your ask is clear. So outside of letting them know, like, these are the impacts, for example, when we're thinking about the global Gag Rule, right? We know that although under the current administration, they have said to completely stop it, but we know when we think about the impacts that it's having on services, that's not how it works. And I think a lot of my fellow co-panelists have already highlighted that, but I think it's definitely important to bring people that have been impacted by this particular legislation and rule from other countries, bringing them to meet with members of Congress, whether that's in person or in a virtual capacity, and really putting a face to a lot of the numbers that we know policymakers really only see. They really only see the data, but they don't really know what that really looks like unless they're either meeting with a person or you're doing a congressional delegation trip overseas to see what that looks like. So I think definitely making sure you're making clear messaging, but also making sure what your ask is clear, like what are next steps? What do you want to see that's happening? And I feel like young people, outside of people that are well-versed in the topic, I think young people are basically the future to unlocking a lot of the change that we want to see move forth, particularly around seeing the Global HER Act be passed.
Thank you so much, Lenise. You spoke a lot to what I was looking for, especially in regard to the Gag Act. I wanted to ask you, so coming from your perspective, if you're talking to a young adult or someone who is trying to get their point across and be clear, and then they are also pursuing relationships with potential stakeholders, how do you advise that they kind of go about that? Because I know for people who may be watching, they may be doing work within their own communities, but getting a hold of policymakers or people in the nonprofit space or people that are actually doing work as well as them may be difficult. How do you encourage people to kind of go about getting other people involved in the work that they're trying to do?
For me, I would say never take no as an answer. I think sometimes hearing no or getting a rejection can kind of be a low blow. I would think, for example, if you're talking about setting up a meeting with a congressional office, I would say as you're preparing for the meeting, training other advocates to prepare for that meeting, always go into that meeting thinking like, that the congressional staffer or the member is not fairly well versed, kind of giving them all the information that they need to know, meaning like, for example, like if we're talking about GGR, what is global gag rule? What are the impacts? What are the impacts that we've seen with the expansion under the previous administration, right? The difference between the previous iteration of global gag rule, known as PLIGA or protecting life and global health, meaning that it expanded beyond sexual reproductive health and abortion. It impacted HIV/AIDS services, maternal and child health, WASH, et cetera. So kind of explaining what the impacts are. If you have someone that has been directly impacted by that rule or an organization that has been impacted, having someone from there kind of speak to what those real life impacts are. If there are data or anything that you can show, also showing that as well, and then kind of going into what your acts are. I would say it's definitely important in advocacy that you're partnering with a wide variety of stakeholders. For example, thinking about GGR, definitely someone that's doing like health services related work. If there's someone that's a physician or a clinician, having them speak to that, having someone from civil society, if an organization is working with the private sector on procuring commodities and so forth, having someone there that can speak to that as well. I think partnerships are key and it's effective. It's really how you're going to see lasting change. And particularly when we're thinking about permanently repealing the GGR through the Global Her Act, I think you need these multi-stakeholders speaking to members of Congress and doing heavy advocacy, also working in partnership with youth to see this rule be passed and signed.
Oh, sorry. Thank you so much, Lenice. I really appreciate you answering that. And I feel like that definitely will help people in the audience who are also young and pursuing partnership and trying to get their voices heard based on the work that they're doing. I wanted to also, continue to throw the question out there. Has anyone else seen effective advocacy, especially amongst the next generation within their communities? Any examples that anyone would like to share? I'd love to hear from someone in another country as well. I don't want to put anyone on blast, but I was going to say it'd be great to hear from Cecile.
Merci beaucoup. Alors, je m'apprêtais d'ailleurs à prendre la
Thank
parole.
you very much. I was actually going to speak. Thank you for giving me the floor. It enables me to share my experiences in Burkina Faso. Burkina Faso is in West Africa, and we have a very strong commitment as regards sexual and reproductive health. In addition, Burkina Faso in the Generation Equality Forum was designated a co-leader of the Sexual and Reproductive Rights Coalition. And this is an opportunity for me to tell you and to show you how in Burkina for access to medicalized abortion, there was a lot of mobilization among the youth to call on authorities to have access to sexual and reproductive rights or sexual health and reproductive. So to have access to a medicalized abortion. I can take the example of the work that we had to do in Burkina, in the capital, to revise the penal code. This revision, why? Because we previously had some difficulties for girls and women having access to abortion. It was necessary and possible for pregnancies coming from rape or incest, but when the life of the mother is in danger, or when there's a problem with the fetus, there were many aspects legally and medically that didn't allow women to have access to abortion. There was a large organization of civil society in Burkina. I will take the example of youth organizations. There's a local organization, an IPPF, then there's the advocacy group with women lawyers association, customary religious organizations, and other organizations in Burkina, Mère Stop in Burkina. And we worked with these various groups to go to the Ministry of Health, Ministry of Women, and the Parliament to call on them to revise these various laws to increase access and women's ability to avoid the traditional legal and health barriers to access to abortion. Today in Burkina, the various advocacy groups that are led by youth and the organizations that I just mentioned, all of this enables women and girls in Burkina to have access to abortion in the case of rape and incest beyond 10 weeks. We had laws that allowed abortion in the case of rape and incest just at 10 weeks of pregnancy, but this modification enabled it to go up to 14 weeks. So we need to see that with this advocacy work, before the global gag rule was much easier. And at the time of the global gag rule, there was a decrease in communication with fear among the political authorities, because this global gag rule had really impacted communication. And we had other opportunities, such as the fact that we work together synergetically for the Maputo protocol that contains more conditions for access to abortion, that it be applied in Burkina, but conditions for accessing abortion were not respected. So this group affected this work that we did with implementing this Maputo rule, even though, well, with this global gag rule, we were able, well, after this, we were able to really increase access to sexual and reproductive health aspects. I'm not sure if I answered the question, but, and I can certainly add more details as regards civil society and youth involvement.
Merci beaucoup, Cécile.
Thank you so much, Cécile.
Okay, d'accord. This was awesome. I don't know if everyone has changed their translation, but if you did not see
Sorry, everyone. I think we're having some connection with Vanessa on her side. So we'll continue to moderate this panel until she can be able to hop back in. If anyone else from our 6 panelists, anyone can jump in to add any other additions for their thoughts on advocacy to continue the conversation.
Yeah, I'm happy to jump in here. In thinking about how young folks can get connected to advocacy, because there's sometimes a bridge that needs to be built there to get folks into advocacy spaces. My chief recommendation here, and what's worked well for me, is to connect to the organizations that are already doing this. So there are great organizations day in and day out that are fighting so hard for women around the world. like Pathfinder, like Women in Global Health, many organizations that are out there that you can plug into. I would follow folks on social media because that's quick information, and often that's what you need from an advocacy standpoint is immediate information. Also, most organizations have an advocacy newsletter, and so that can be another great place to go for advocacy information. And what I'd like to impress upon you is that, as our other panelists have explained, that it's not just local issues, it's not just national issues, it's not just global issues. These things don't exist in isolation, but they're all connected, right? So plugging into your local organization may not seem like a big deal, but local issues become national issues, and national issues impact the globe, right? I mean, that's what we're talking about here, is a national issue that's impacting everyone. So I would encourage you to look at organizations on different scales to plug in at a local level, at a national level, and at an international level, so that you can see these pieces of legislation, these advocacy issues, and how they move throughout these scales, because that's important, how they're all interconnected. And I would also encourage you that there's no space too small, right? That your local organizations can be really powerful, because again, those local issues, those local things you're dealing with can become national and even international issues. So plug into your local organizations, plug into Women in Global Health, plug into Pathfinder, plug into these broader organizations too, so you can see these issues and the whole scale upon which they operate. And then, because I love to see women in leadership and love to see women in global health leadership, I would also encourage everybody that's here that has that little voice in the back of their head that says, I think this is important to me. Like, I really think this is something that I deeply care about. I would encourage you to go after leadership. And even if right now that's in a small local organization, if that's what's available to you, even if you have dreams of wanting to have a global impact, go after those local organizations that are doing the good, doing the good fight, right? Doing the good work. That are close to you right now, because global leaders didn't just wake up in that position one day, right? They came from local organizations, and then they moved to national organizations, and then they moved to global organizations. So get plugged into the opportunities that surround you now, get plugged into the issues that surround you now, pay attention to the scales, right? To how these issues are moving. And absolutely your impact one day can and will be global.
Absolutely. Thank you, Andy. Those are all wonderful points. Before I wrap up today's event, I did see, Cecile, you had your virtual Zoom hand raised. Did you have any more thoughts to add?
Yes, Iman. I think that Andy just answered. The fact that this advocacy work that we do at the national and local level needs good experiences at the international level. And in terms of universal access to rights, I would just like to confirm what Andy has said, and that is civil society organizations in Burkina Faso have seized opportunities regionally and internationally to really take the advocacy that we do in Burkina, to really nourish it, to tell the authorities that it's our ability to act, our health, our bodies. And if this is being done as advocacy to improve public policies for the health of young people and adolescents somewhere else, there's no reason that we in Burkina Faso can't have access to abortion. And that has enabled youth to gather evidence internationally to use that in their work in Burkina. That's what I wanted to add and confirm, that yes, this has been the attitude in our national advocacy, to go look elsewhere. I see in Burkina different coalitions coordinated by Pathfinder, by MSI, by Médecins du Monde. Young people have gone to have good experiences elsewhere to come back and claim their rights with the authorities in Burkina Faso. And that has nourished the current context. And that tells us that it's another opportunity for youth organizations in Burkina to really seize this opportunity with the Global Her Act to really strengthen their actions for more rights in Burkina Faso. Also, we need to be able to strengthen youth even more, because it's true that there are good practices and experiences, but in our context, especially with the security crisis that is simmering in our countries. There are many women who are in rural areas who are internally displaced persons who have left and fled their residences because of the lack of security, jihadism, terrorism, who are in the streets. And there we need to strengthen local organizations. And I would emphasize that because these local organizations are those who welcome, they are the host populations, they welcome these IDPs. And when they move, there's sexual violence, there's rapes of women in these camps of displaced people. And there we really need to mobilize with the help of international organizations who have the financing. And I can conclude by saying that in Burkina, you have several US organizations who are engaged in this fight and in promoting women's ability to act, to claim their rights and access to abortion. And this, I would seize my opportunity to do advocacy myself, to tell you that we need to continue to finance and mobilize youth organizations so that they can talk to the authorities and claim their rights. Thank you so much.
Thank you so much. We're very lucky to have your remarks, your very powerful voice within our webinar today, and as well as the other 6 panelists. We're going to be moving into our Q&A session. Before I start my closing remarks, though, if anyone on this webinar has any questions for our wonderful panelists, please put that in the chat, and I will get to those briefly before we close off officially by 12:15. But first off, thank you very much for everyone that has joined, our partners with Women Global Health, all our panelists, everyone in the back end that has put this event together. We want to share that our biggest takeaway, our biggest call to action is stay involved, like our panelists have been saying in the advocacy portion. Put forward your voice, speak up, speak out, be involved with Pathfinder, be involved with Women in Global Health, and stay up to date with all that's going around. I know there's a lot going around in the world, but make sure that you're aware and you put your efforts in for matters that matter. So in the chat box, we'll have our links and all the hashtags on how you could be involved with Pathfinder. I'll give it to Mwende to say how you can be involved with Women Global Health as well. Mwende?
Thank you, Iman, and hello to you all. I would love to thank all the speakers and participants for being part of this event. I also thank Pathfinder for working with us to create this platform to have this timely discussion on the Global Her Act. The brutal truth is that the global gag rule contributed to deaths of many women left with no option but unsafe abortions and also unwanted pregnancies. And these are the poorest women. And we need to keep in mind that women with resources have options, but not all women have resources. I am honored to speak at this exciting event to share the Women in Global Health perspective on the power of women's movements. Women in Global Health is an organization that is built on a global movement with the largest network of women and allies that are working to challenge power and privilege to seek gender equity in health. The organization started in 2015 and has now grown to have over 50,000 supporters, in 90 countries and officially 25 chapters. We have strong presence in low and middle income countries. We also focus on women's leadership in health, investing in health workforce, gender transformative health systems, and supporting strong women's movements. As we mobilize to create enabling environments for enactment of laws such as the Global Her Act, it is important that we pass the mic to those most negatively affected so that they can drive solutions. Women and health workers across the world, 70% of whom are actually women, are working together to advocate for gender transformative policies and also health systems that address the needs of all people. We've heard from our chapters in Nigeria, Niger, Burkina Faso. We've heard from also our chapter members across the US. And one of the main things we know is that chapters are really coming together and to organize for change around this. And a great example is our chapter in Chile, that worked with the President of the Senate and also worked with 150 other organizations to get the government to publish data on access to abortion during COVID-19. Our chapter in Somalia also convened civil society organizations to put pressure on the government to make sure that there was sex aggregated data being shared during COVID-19 as well. So it is possible for women to work together to lead change. One of the main things that I would want to say is that these are some of the examples of what chapters and women and allies that are part of the Women in Global Health movement are doing to mobilize, advocate, gather commitments, and also hold leaders accountable. I hope that for all of us who have participated today are energized ahead of the 26th anniversary of the Beijing Conference on Women's Rights and the Generation Equality Forum. And as I close, I want to leave you with 3 main points, which I think we should definitely carry on. 1, there is a need for continuous education and access to information for girls and women on their rights. This includes sexual, reproductive, and health rights, and also healthcare options that they have. To achieve this, we must make sure that health workers are enabled to lead, especially midwives and nurses who have tremendous power and actually have the trust of their community. Currently, only 25% of women are in leadership in global health, while they are actually the majority of health workers. The second point is that it is very important to include a gender transformative approach in how we design and deliver and also monitor health systems so that we are able to achieve gender equality. And one of the main things we need to make sure is that there's a radical and deliberate action which allows women to play an equal part in leadership at all levels, from the community to the global level. Lastly, I would like to say that it is important for funding institutions to support women and young people, their organizations and their movements at all levels, so that then they're able to lead the change that they wish to see. We have seen that in 2016 and 2017, there was increased funding that was allocated to gender equality, but only 1% of that funding reached to women's organizations and also young people's organizations. So we need to make sure that the money is placed at the hands of the people who are able to lead this change and understand the context, so that then they're able to influence policies, not just at a global level, but also at a local level. As I conclude, I urge us all to take time to familiarize ourselves with the Global HER Act and play our part in creating awareness on its urgency and benefits. Let's keep tabs on the Generation Equality Forum, which is coming up soon, because this is a platform that allows for us to advocate around bodily autonomy and also sexual, reproductive, and health rights. I leave you with this quote from Margaret Mead: "Never doubt that a small group of citizens can lead change. Indeed, it's the only thing that ever has." Thank you, Iman.
Wow, that was amazing. Thank you, Mwende. Very powerful. I got the chills for a bit. I would like to go into our Q&A session. I've picked 1 or 2 questions, but because of time, I won't be taking any more. But these 2 questions I think are very relevant to anyone on this webinar. And for any one of our panelists, what are any tips that you have for talking about what can be a taboo topic? For those that are not comfortable with having these conversations, what ideas, any stories that you've had in your experience where you've entered an uncomfortable conversation centered on a taboo topic, and how you could guide yourself to making sure that you communicate messages that we've talked about today, or getting someone to understand a matter that is taboo.
So I think that personalization can be a really powerful tool. I think that's why advocates that are personally affected by issues can be some of our most persuasive and powerful advocates, right? If you can go to somebody and say, this is how this is going to affect my life, right? There may be some choices that I don't have now if this happens, or I may be harmed in this way. You're forcing that person to personalize what's kind of an abstract concept, right? They're maybe just looking at numbers. They're maybe not thinking about how this is going to impact an individual. And if you can stand in front of them and say, this is what I'm struggling with, this is how this is maybe going to hurt me or harm my family, that forces them to wrestle with the reality of the legislation, right? Not just the concept of it, but how it's really going to impact people. And that can be persuasive, and it allows you to speak from your own truth, right? And I always feel most confident when I'm speaking from this is who I am and how I'm going to be impacted.
Absolutely. Anyone else have any thoughts? You can jump right in. If not, I'm happy to go on to the second question. But Kashmira, did you have something to say?
Yeah, sorry, I was a little bit late with my mute button. But no, I just wanted to echo what Andy said. I think, some of these powerful stories have been pretty, important in a lot of these places where, again, the taboo, sometimes it's even understanding what some of the community perceptions are, what are some of the issues that are really pervasive, what are some of the viewpoints. So I think even just listening sometimes can help with crafting messages that may resonate with the people, and even like starting from a small change. I think that can be very powerful.
Yeah, I agree. I definitely agree. For our second question, we had one in the chat box that asked, has there been, and this is for any panelist, has there been any mentors or other partners that have helped you be successful in your advocacy work? And how did you find them and seek their support? I think this is a wonderful question for our next generation leaders in this webinar, to learn from your experience and to get those tips and guidances on how they could best apply that.
Wait.
Yeah, go ahead, Kashmira.
Yeah, I wanted to see if somebody else. Maybe let's Cecile talk first.
Yes, Cecile, go ahead.
Oui, merci beaucoup.
Yes, thank you very much. I wanted to give an example from Burkina Faso, where one of the successes or something that enabled us to have success in our advocacy work was involving decision makers themselves and political authorities. The fact that we really worked with them as allies, and we helped strengthen their capacities as well, because sometimes this has helped us to really change the political environment. Sometimes they don't really understand all the issues, and so they need to be educated about them. So working with them as allies in Burkina allowed us to have a stronger alliance, and then they understood the issues better, and they understood the approach for public health better, and what they should do as authorities. So that was one thing that helped us in Burkina. And also the fact that they heard from people who were concerned or involved themselves. Recently, we had a campaign about access to abortion, because this is a taboo subject often. And we use social media because a lot of young people, as you know, are on social media. And we tried to make this a more everyday topic, something that wasn't taboo, and to really talk about this as maternal health and women's health, and to also talk about how there is a lot of clandestine abortions in various countries and the negative impacts of that. And we did policy briefs. We also had some audio and videos of testimonies of survivors, people who were victims of these illegal abortions and the consequences that these had on their lives. And so hearing their stories helped, first of all, make sure that they no longer were reduced to silence. And it also helped lift the taboo and to make it something that people talked about more openly. So there were two actions, if you will, on the side of the authorities, involving them more, but also strengthening communication with communities and making these topics more open discussions and things that people can talk about openly. Thank you.
Yes, absolutely. Thank you, Cecile. And kind of a follow-up question related to what you just mentioned is, with the work that you do to make sure that your relationships with stakeholders and other individuals in the community is being fostered and stuck still with the work that you're doing, how do you stay motivated? How do you keep it pushing when a lot of times we hear unmotivated messages? And as leaders, as next generation, we want to keep the momentum going. So does any one of the panelists have thoughts, ideas, or tips on how to stay motivated on items that are a bit hard to keep it moving.
Maybe I'll go ahead. I was going to add earlier too that I think that in general there is a mindset that you need, some more senior mentors or to be able to affect a change. I think as Andy said previously, like if you deeply care about something, I think that is a phenomenal motivation already. And then like really seeking out some of these other people who similarly deeply care about the same issue. So never underestimate the power of peer-to-peer mentoring and peer-to-peer support as well. And then when you can, speak in one voice and, when there are more voices that join in, I think that can really be, quite empowering and, and then can get the attention of people who may affect that change. So, starting from where you are, if you deeply care about something, then, just seek other people who have a similar, viewpoint and deeply care about the same issue.
Sure. Thank you, Kashmira. Does anyone have any final comments, final thoughts before we end today?
Yes, I'll go. Oh, did you want to?
Yeah, really, before I jump off, just to add to Kashmir, I think when we're doing this type of advocacy work, always remembering what your why is, why you got into this work, and sticking to that. Yes, it can be exhausting and tiring, but always making sure you're setting time to take a step back and reevaluate why you are doing to this and staying committed to seeing that long-term change that will come from it.
Absolutely. Thank you, Lenice. Pedro, you want to go ahead?
Yes, I just wanted to add to that yes, it's very important to remind yourself the why. It's also very important to find a community, so that what I do personally is that on the days it gets tired, I outsource my frustration. So I pick my issues and I spread it. It's very effective for me. I spread it to, so I'll give an example. I'm here because speaking as Women in Global Health Nigeria, I think one of the most powerful things that Women in Global Health did was to ensure that the voice of women in low to middle income countries, women from the global south, was included. I had never actually seen an organization that was committed to ensuring that you had voices from the global south in the room like this before. And the minute I got here, it was like, the lights are burning in your mind. They might be dim for a while. Once I got in and I saw this, the lights came on full blast, and I was like, yes, this is the community that not only respects it, but went out of its way to look for the voices of women from the global south. And then being in this space, Women in the Global South, having peer-to-peer conversations with women who are from lower to middle income countries like me, helped me to see that we have very many similarities in our situation. There are things that I can learn. Some people from the chapters I now consider friends. Hi, Asanatu. We speak to each other. We share with a very many similar, our health systems are similar, our societies are similar, the attitudes in policy are similar. So when you do feel frustrated, know that number one, you're not alone. Second, continuing to have conversations. Sometimes, it's good to have a local network, but then it's also good to foster relationships that go beyond the borders of your own country. And then when you look at how someone else in maybe Burkina Faso is dealing with an issue that has good similarities, it's easier to connect with than what somebody from a high income country might be doing. And even then, within Women in Global Health, there are bridges and connections, with organizations fostering other organizations, learning from, the knowledge is two-way. So once you have a community, whether that community is local, global, or continental, it's easy to deal with frustrations, either individual frustrations or frustrations as an organization. It's always good to keep those relationships going, because you're in the same space with the same fire and passion. It's very easy to make friends, because, you know, there's a certain trust that comes from people who have the lights on and burning for similar things. So the trust has been through the roof, and have many relationships here that have helped us personally as an individual, and then as Women in Global Health Nigeria to move forward. And I wanted to honor that and you know, share that in this panel today.
Yeah, community is the key word that I took from that. Before we close off today, Asanatu, do you have any comments?
Yes, yes. Just to add to what others have said, and my apologies because you may hear a background noise because we have light shortage and the engine starts to provide light so I can continue this conference. This is a life in healthcare in Africa and Africa as a whole. So coming to what Peju just said, when you see the woman, you make sure you give all the package, especially because you might not see the woman again, and also because you might not be capable too, because if this woman come back and I don't have light to work on her, so it will be quote unquote. So adding to the advocacy part, I want us to like share this, like going back home with the power of the community engagement. I have seen that my humble experience with community engagement can bring an intervention to the positive or negative side. And the decision and commitment from even local higher level leadership can also come from bottom up. So when the government and the people in authority are not doing what they have to do, you can use the community to reach out to them. When community raise up and reclaim some things, the government have to bind most of the time. And we also, most of the time, we fall under the health literacy issue because especially in the rural area, we don't give much time to foster, to polish about health literature for them to better understand and better participate into the development and implementation in our intervention. And plus to that, we all have fallen under this health literacy umbrella with COVID-19. So we can do better by integrating community for us to move forward together. Thanks.
Yes, thanks, Asanatu. We can definitely do better. And I hope that's one of the main takeaways that we've gotten from this panel. I would like to thank the attendees. I hope you all had fun. I hope this was an exciting conversation for you all to take away into your careers and into your personal lives. I'd like to give a special thank you to all of our panelists, Kashmira, Cecile, Andy, Lanice, Asanatu, Peju. Thank you very much for giving us your time and sharing your wisdom and knowledge with us. Thank you, Mwende and the Women in Global Health team for partnering with Pathfinder on this amazing event. We'd like to thank you all, and we hope you have a wonderful rest of your Thursday, a wonderful weekend, and hope to catch you guys soon. We'll be in contact with everyone through our Twitter handles, and that will be sent out, and the recording will also be shared too. Thank you all.
Thank you.
Bye.